Right. Hello, Mrs. Stein. My name's Melanie. I'm a physiotherapy student with the pulmonary rehab group. I understand you've been referred to pulmonary rehab following your recent admission into hospital from your flare-up of your COPD, is that correct?
Yeah.
Do you have any knowledge of what this class is all about, or any knowledge at all?
No, not really.
So really, when people are discharged from hospital from the flare-up of the symptoms, they refer you to us within 4 weeks of your discharge. So it's people like yourself with respiratory conditions such as COPD, and it's mainly just to help reduce the risk of you being readmitted into hospital again, to improve your exercise capacity and to really improve your quality of life and just get you independent as you can be. So in general, when you have an admission into hospital and following that admission, people generally get a lot weaker, and I don't know whether you've noticed that yourself.
Yeah.
I noticed in your notes that you're struggling with stairs and things, is that correct?
Yeah, that's right.
Yeah. And walking as well, wasn't it? That's been an
when
issue.
I walk like more than 40 metres, I just feel like I can't do it.
And you're relying on your husband, is that correct?
Yeah, like when I drive.
Yeah.
Things,
So really, with that being, you're going to have that weakness following that admission, that's really our aim, just to help strengthen you back up so you can be as independent as you can be and not rely on your husband as much. But do you feel like you avoid doing activities because you know you're going to get breathless?
Yeah, I do actually, yeah.
So this is also very common with COPD patients, just that avoidance of doing activities. So that is going to lead to your muscle weakness, your general deconditioning, and you're going to notice that you fatigue a lot quicker.
Yeah.
So this is like an inactive lifestyle that you end up adapting, which that's what we want to avoid. We want to get you out of that cycle of inactivity, and just to increase your really your knowledge about the condition and how you can manage your breathlessness, and just to push yourself that little bit further and get you back to doing things as independently as you can do.
Yeah, that's
all right.
right.
So before we get you enrolled onto the course, we do like to do get a little bit of background information off you, so such as your past medical history, just to make sure there's nothing underlying that would prevent you from taking the course. We would also fill in a quality of life questionnaire, and obviously we'd look at that before the programme and after the programme, and just like to see where you've come and progressed to. And we also complete breathlessness information, so we would just see how breathless you would be on daily activities such as getting dressed, doing the housework, brushing your hair, and again looking at those scores following the programme. And we also like to complete a 6-minute walk test before, just to get ourselves a baseline of what you're at, what your level of activity is, until you feel like you need to stop because of your breathlessness. And then we will measure that again following the programme to see how much you've improved. And a lot of people do really improve on the walking, and they do walk that little bit further, which is really good for yourself.
Yeah.
And we also like to work with you to set some goals for during the programme and after. So it could be a little thing like you want to be able to hoover again, or I know you rely on your husband quite a lot, and I read in your notes that you like to see your friends, so it would be maybe a goal to set that you would be able to drive to see your friends on your own, just something like that. So we'll work with you to set some goals, and like I said, we just use this information to see how far you've come, really.
Yeah, sounds good.
Sounds good. So just a little background about the classes. So they run for, we say, around 6 to 12 weeks, twice a week, which is a supervised session with myself and normally a physio assistant in there as well. So you always will be with somebody, and it is quite a scary thing we're asking you to do, is exercise when the last thing you want to do is feel breathless. But that's the whole point of this programme, is to get you used to controlling your breathlessness and not doing things just because of that.
Yeah.
So it normally lasts around an hour. Could be a little bit quicker than that, depends on if there's a talk afterwards or not, which I'll explain in a minute. And we would also like you to complete a little bit of exercise at home a further 3 days a week, so around 30 minutes of exercise, but we will give you a programme for that. And the exercises are individually set to your needs, so everyone in the class will be following their own little programme, but it will be adapted to you. And I know you have knee conditions, so we will adapt the exercises so it's not really going to aggravate your symptoms of your knees.
What kind of exercises will I be doing?
So you will have exercises such as, we do a lot of walking, we have a treadmill, we also have a static bike as well, so we can get you to do that, which will be good for your arthritis. We do step up practicing, so to help strengthen and get used to walking upstairs and downstairs. We also do upper limb type of bicep curls with weights and different things like that, so it's just bringing in that bit of functional exercise as well, so that it can incorporate into your daily tasks, but generally try and build the strength up in your muscles and the endurance, so you can last that little bit longer. Is that
Okay.
alright?
Yeah, that sounds good.
So there'll also be educational classes following the exercise classes. So these are normally run by other healthcare professionals, such as occupational therapists, your doctors and nurses. So really they'll just give you a mix of information, such as a background about the condition and what's going on in your lungs and why you feel breathless, and just to get you to understand your condition a little bit more. A bit of nutritional background, psychological and behavioural interventions as well, because a lot of people do suffer with depression and anxiety and stress, so that can be discussed in that. And also breathing techniques, just to get you used to using different techniques to slow down your breathing, and also positioning in bed to help with that as well. And do you have any questions or anything?
So, will this pulmonary rehab class cure my COPD?
Unfortunately, rehabilitation, it won't reverse the damage that's already done in your lungs, but we can help increase your muscle strength and your exercise tolerance, just to help you be as independent as you can be, and just help you to control your condition a lot better, and just manage your breathlessness and your anxiety, and just to mainly reduce that hospital admissions as well. So like I say, we just want you to be as independent as possible and not have to rely on your husband and things like that. Does that sound alright? Does this sound like something that you'd be interested in? And
Yeah, it sounds really good.
taking part? Good.
Yeah.
We'll get you signed up for that then.
Sounds good.
Thank you.